Gallbladder meridian is one of the longer meridians on the body. It has 44 points, and it covers the entire side of the body. So the gallbladder meridian has some interesting pathway. Let's just take a look at the overall pathway, and then we'll look at the individual points. So the gallbladder meridian begins on the head, just next to the eye, and it goes then towards the ear, and then it makes back and forth curves across the head, so it covers the entire side of the head, and it comes down kind of the side and the back of the neck and across the top of the trapezius, and then it picks up on the side of the body here, and it does some crisscrossing across the sides of the body all the way down through the buttock, and then down the sides of the leg, and then across the side of the top of the foot here. So the whole lateral zone of the body is kind of traversed by the gallbladder meridian. And we'll see that it treats pain along the sides of the meridian quite commonly and quite well. So let's take a look at some of those individual points. We'll start up here at the head. Right. Gallbladder 2. Let's begin with gallbladder 1. Gallbladder 1 is just about a half a sun lateral to the outer canthus on the edge of the orbit of the eye. So this gallbladder 1 is here. Gallbladder 2 is just level with the intertragic notch and just a little bit anterior. Again, you fall right into this space here. Gallbladder 1 is a good point for eye problems. Gallbladder 2 is a good point for ear problems. From gallbladder 2, gallbladder meridian, gallbladder 3, gallbladder 4, 5, 6, 7, it kind of comes up the side of the head here and then comes back to gallbladder 8. So the main points that I want to draw your attention to here, and again, as I said, remember the gallbladder meridian does this kind of back and forth across the side of the head, and then it shows up back down here at gallbladder 20. So the main points that we want to be concerned with are gallbladder 1, gallbladder 2, gallbladder 8, and then gallbladder 20 is the next point that we're going to find. Let me show you how we might needle gallbladder 8, because it's on the side of the head. And again, there's not a lot of space here. Gallbladder 8 is 1 sun superior to the apex of the ear, and usually it's needled either from front to back or from back to front. So we'll needle it from back to front here so that you can see the needling technique. Again, a fairly strong, fairly transverse angle is the best way to needle when you're needling on the head, and very simple. And you can give that a little spinning and a little lifting and thrusting in order to stimulate that point. Gallbladder 20 is a very important point for treating disorders of the head, disorders of the nose, the eyes, the mouth, the ears. It's said to open the orifices of the head. So gallbladder 20 is located in the depression where the trapezius muscle and the sternocleidomastoid come together. So just under the occiput here in this depression is gallbladder 20. The angle of insertion, the angle of needling for gallbladder 20 is to needle towards the tip of the nose. So when we insert the needle at gallbladder 20, we want to angle it up a little bit and a little bit in towards the center of the head, and just about like that. And again, you can do lifting and thrusting and twisting here a little bit. And gallbladder 21 is another point that I would like to point out to you. The final point here before we move to the lower parts of the body. Gallbladder 21 is at the top of the trapezius, at the highest point on the trapezius muscle, halfway between large intestine 15 and the neck, basically. So right in the middle on the top of the trapezius muscle. Again, this is a very important point. It's used for tension and tightness in this muscle, which many, many people suffer from. And we want to be careful that we insert the needle only very shallowly here if we're going to do a perpendicular insertion, which is quite common in order to get a strong stimulation. The safest and most practical way to needle this would be to needle it more, again, on a transverse or transverse oblique angle. So either very shallowly, or if you need to stimulate it more strongly, we might get that on a more transverse angle. Okay, let's move lower in the body now. Okay, so just to get that visual again, now that we've got the side of the body presented to you, gallbladder meridian covering the sides of the body from gallbladder 1 to gallbladder 2, up the side of the head, back and forth to gallbladder 20, over the top of the trapezius, gallbladder 21, gallbladder 22, and gallbladder 23. Then it sweeps forward to gallbladder 24, sweeps back again to gallbladder 25. Gallbladder 25 is at the free end of the 12th rib. It's the front moo point of the kidneys. And then gallbladder 26, which is just on top of the crest of the iliac spine. Some sources will put it a little bit higher level with the belly button. I like to needle it just over the top of the iliac spine, and I like to needle it on a bit of an angle down, on a perpendicular oblique angle, superior to the iliac spine, just like that. Get a little bit of stimulation there. This is, the name of this point is daimai, and it opens up the daimai being the belt meridian. And so it treats many different disorders, from low back pain through to discomfort associated with the menstrual cycle, lots of lower, warmer problems. So gallbladder 26 is here. Gallbladder 27 is just anterior to that. It's just anterior to the ASIS, to the anterior superior iliac spine. And gallbladder 28 just below that, about a half a sun. So they're very close together, gallbladder 26, 27, and 28. We're going to move our model into another position and pick up with gallbladder 29 just on the other side of this frame. So the gallbladder meridian, in keeping with its theme of treating things on the side of the body and treating the lateral aspect of the body, is particularly good for hip pain. And there are two particularly good points, gallbladder 29 and 30, correct. So we looked at gallbladder 26, 27, and 28. Gallbladder 29 is located halfway between the ASIS, which I can point to it right here for you, the ASIS, and the head of the greater trochanter, which can be easily palpated as well. So half the distance between the ASIS and the greater trochanter right here is gallbladder 29. And once again, your finger very easily falls into gallbladder 29. It would be hard to miss this point. Generally, when we can palpate this point, if someone is having hip pain, either gallbladder 29 or gallbladder 30 will be sensitive to the touch and will be in need of needling. I generally find gallbladder 30 to be the most sensitive point in this area. Gallbladder 30 is located 1/3 the distance from the head of the greater trochanter to the junction of the sacrum and the coccyx. So you don't need to palpate that out on your patient. You can just kind of eyeball about where that will be. And gallbladder from the head of the greater trochanter going towards the junction of the sacrum and the coccyx, and you go 1/3 the distance, and once again your finger falls right into this point. Again, would be difficult to miss. Needling, you can needle this point fairly aggressively if someone has a lot of pain. And you can also needle it fairly deeply to get to some deeper levels of pain. We're just going to set the needle in here to show you, but once again, a very commonly used point for hip pain. Now let's move on to gallbladder 31 and beyond. Let's finish taking a look at the rest of the gallbladder meridian. So the gallbladder meridian, we're moving from gallbladder 30 to gallbladder 31. Gallbladder 31 is located easily by having the patient simply put their arm at the side of their leg, and where their index finger, the tip of the index finger touches, is gallbladder 31. It's also easily palpated. Again, running your finger between in this ridge between the muscles bundles, and your finger easily stops at gallbladder 31. So there's gallbladder 31, a very good point again for pain in the hip, pain in the leg, sciatica, things like that. Gallbladder 34 is located between the heads of the tibia and the fibula. So just between the two heads of the tibia and the fibula, and just inferior, we can get our finger into that little space under there. This point is generally needled with the knee slightly bent. It's needled again at a perpendicular oblique angle, a little bit up, so that we're kind of getting in and under kind of where those two bones come together, right? And gallbladder, so there's gallbladder 34, gallbladder 35, 36, 37, 38, 39. It just runs down this way. We'll take a look at gallbladder 39 is 3 sun superior to the lateral malleolus. You'll remember spleen 6 on the inside here is kind of the corresponding point to gallbladder 39. They're just opposite one another. So gallbladder 39 is 3 sun superior to the lateral malleolus. Gallbladder 40 is just inferior and anterior to the lateral malleolus. And then gallbladder 41, I want to point out to you, gallbladder 41 is an important point. We use gallbladder 41 quite regularly because it's the master point of the daimai. And the daimai, again, is that belt meridian, and it goes around the waist, and it treats all types of problems associated with the lower warmer, everything from back pain and sciatica to pain, pelvic pain, etc. So gallbladder 41 is located just under this, most lateral extension of the extensor digitorum here. So these tendons, we can see this tendon if I pull the pinky out. If I ask you, could you please flex your toes up for me like that? If we ask our model to flex her toe, Monique flexes her toes, we can see this tendon popping out. You can relax now. You may be able to see that. I can see it quite clearly. So where the 4th and 5th metatarsals come together, just distal to the junction of those two bones is where this tendon crosses over the 4th metatarsal. So we want to insert the needle at gallbladder 41 just lateral to this tendon and actually kind of slide it under. So we're going to do a transverse insertion, and we're going to try to slide it just under that tendon. So we miss the tendon and we stop short of the bone, just like that. When you needle this point, there should be a dull, achy sensation, but not very, it should be strong, but not uncomfortable for the patient. Right? Gallbladder 41, an important point. Gallbladder 42 and 43 run down here, and then we come to gallbladder 44, which is the final point, which is at the corner of the nail, of course, on the lateral aspect of the 4th toe. Okay? That covers the gallbladder meridian. We'll move on.